It's a city office that we may not hear about too often. The Youngstown Local Office on Minority Health has been awarded a $52,000 grant from the Ohio Commission on Minority Health. And those funds will help in the effort to improve health outcomes for underserved populations in our local community. The Director of Minority Health, Jamille Murphy, is with us right now at 5 to explain more about the division of this health department option and just the funding, how it's going to help you. So thank you for being here.
Thank you for having me.
Yes, so tell us, how much the grant's going to help the minority division of the health department. What are you going to use it for?
So the grant, this $52,000 grant, will help us continue the critical work in addressing the health disparities in Youngstown and Mahoney County, particularly in the areas of infant and maternal health, chronic disease prevention, mental health awareness, and culturally responsive care.
Okay, and talk about it, because you have really important programs, including that infant mortality program, because you want to lower those rates.
Yes, we do. We want to lower the rates.
And how will the money help with that? What do you think are some of the most effective ways that you're going to be able to use that funding?
Using it by health educational workshops. That's what we like to do. We like to put on the educational workshops, health screenings, and just educate the moms.
What are some of the things that a lot of moms learn when you educate them? I know, being a new mom, sometimes, I hear from my friends, I remember going through it myself, there's so many unknowns. Right. So what are the major things that they're learning when you reach out to them and try to help them with this?
They're learning things about safe sleep. Postpartum depression is important. Breastfeeding nutrition is also important. But safe sleep, we have a lot of infants that are losing their lives because of safe sleep. A lot of parents do co-sleeping, and that is, detrimental to a child's health.
Okay,
yes.
Important stuff.
Yes.
Yeah, it is so hard with the sleep schedule.
It is, yes.
Parents need to learn.
Exactly. Yeah, I did co-sleeping. I have 3 kids, and they slept with me, but I don't think that, it was brought to our attention about safe sleep when I was having kids. So safe sleep is one of the important factors. Breastfeeding nutrition is also important.
Okay, wonderful. Well, thank you so much. Real quick before we go, systemic health challenges that the minority groups face, what are some of the top things that you help people with that maybe, they're not getting the treatment on or they don't have the awareness about?
Quality of care. Yeah, quality of care is important.
Okay, wonderful. Well, Jamille, thank you so much for joining us right here at 5. Thank you so much, and congratulations on getting this grant. I know you're, like you said, you're going to use this in a lot of different ways.
We are. Yes, we are.
All right. Thank you for being here.
Thank you.